Asthma and bronchiolitis are common respiratory conditions that affect millions, especially children. While they share some similarities, they are distinct conditions with different triggers, symptoms, and treatment approaches. Asthma is a chronic respiratory disease characterized by inflammation and narrowing of the airways, making it difficult to breathe. Imagine your airways like tubes that carry air in and out of your lungs. In asthma, these tubes become swollen and narrowed, making it hard for air to pass through. Bronchiolitis, on the other hand, is an acute, usually viral infection of the lower respiratory tract, primarily affecting the bronchioles, which are the smallest air passages in the lungs. This infection causes inflammation and mucus buildup in the bronchioles, leading to breathing difficulties, especially in infants and young children. The key difference lies in their duration. Asthma is a long-term condition, while bronchiolitis is a short-term infection. However, both conditions can cause significant respiratory distress and require prompt medical attention. Recognizing the signs and symptoms of asthma and bronchiolitis is crucial for early diagnosis and treatment. While some symptoms overlap, there are key differences to look out for. Common symptoms of asthma include wheezing, a high-pitched whistling sound during breathing, coughing, especially at night or early morning, shortness of breath, feeling like you can't get enough air, and chest tightness, a feeling of pressure or pain in the chest. Bronchiolitis, on the other hand, often presents with a runny nose, a common cold-like symptom. Cough, which may be dry or produce mucus, wheezing, a whistling sound during breathing, rapid breathing, also known as tachypnea, and difficulty breathing, often with visible effort. Infants with bronchiolitis may also exhibit signs of feeding difficulties, refusing to breastfeed or bottle feed due to breathing problems. It's important to remember that these symptoms can vary in severity and may resemble other respiratory illnesses, highlighting the importance of seeking medical advice for an accurate diagnosis. Diagnosing asthma and bronchiolitis involves a combination of physical examination, medical history, and specific tests to confirm the diagnosis and rule out other respiratory conditions. For asthma, your doctor will perform a physical exam, listening to your lungs for wheezing or other abnormal sounds, and inquire about your medical history, including any family history of asthma or allergies. To confirm the diagnosis, they may perform lung function tests, such as spirometry, which measures how much air you can inhale and exhale and how quickly you can exhale. Bronchiolitis, being a clinical diagnosis, relies heavily on the child's symptoms and physical examination. Your doctor will assess your child's breathing, listening for wheezing or crackles in the lungs, and observe their breathing pattern. In some cases, a chest X-ray may be ordered to rule out other respiratory infections, such as pneumonia. Treatment for asthma and bronchiolitis aims to relieve symptoms, improve breathing, and address the underlying causes. While bronchiolitis often resolves on its own with supportive care, asthma requires long-term management to control symptoms and prevent exacerbations. For asthma, treatment typically involves a combination of quick relief medications, such as bronchodilators, which relax the muscles around the airways, and long-term control medications, such as inhaled corticosteroids, which reduce airway inflammation. These medications are often delivered through inhalers, which allow for targeted delivery to the lungs. Bronchiolitis, being primarily viral, often doesn't require specific medications. Treatment focuses on supportive care, such as ensuring adequate hydration, providing humidified air to ease breathing, and using saline nasal drops to clear nasal congestion. In some cases, oxygen therapy may be necessary to maintain adequate oxygen levels. Remember, seeking prompt medical attention is crucial for both asthma and bronchiolitis, especially in infants and young children, to ensure timely diagnosis, appropriate treatment, and the best possible outcome. For more insights on respiratory health, subscribe to my YouTube channel and follow me on social media. Stay informed, stay healthy.